Chain Drug Review, and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello, everyone. I'm Jeffrey Wolt, Editor-in-Chief of Chain Drug Review and Mass Market Retailers. Welcome to our video forum. Today, we're thrilled to have with us Dr. Vin Gupta, Chief Medical Officer at Amazon Pharmacy. Amazon recently extended the availability of RX Pass to Medicare beneficiaries. What is that going to do for that population?
Well, Jeff, I think this is just going to be yet another option for somebody who might be receiving their pharmaceutical benefits through Medicare Part D, who is also a Prime member. We know Prime is a membership program that many Americans take advantage of. So if they are an individual that's a Part D member, that's also a Prime member, they can have access to RX Pass. And again, it's just one option to receive your medications in a very simple, sort of predetermined way, where if you're on one of the medications on the formulary, or if you're on 10 of the medications on the formulary, it's $5 a month as an add-on with free shipping. It's what we've seen since we launched in early 2023 is this movement towards increased adherence, increased fill rates on refills at decreased out-of-pocket costs. And so this is no longer an abstraction. What we thought when we first launched this was that this is really going to simplify the process of being on chronic medications for many adult Americans across the United States. 50% of adult Americans are on at least one of the medications on a formulary for RX Pass. And we really believe that we were delivering on the actual clinical outcomes that we thought back in 2023 we'd be driving. We're seeing that, and we're saving people money.
Amazon recently expanded delivery of prescriptions to the New York and Los Angeles markets, and you have more on the horizon, I know. To what degree does that answer critics who say online pharmacies can't provide the same sort of care, acute care, that traditional brick-and-mortar retailers can?
Well, to those critics, I would say that, and I say this as a pulmonologist that is at the bedside, that I hear this directly from patients, as to my colleagues, that the existing set of solutions is not working. So even if we think we have a set of solutions, it's not meeting the moment. And Jeff, I think we can all agree the pandemic really shone a light on how insufficient this existing pharmacy solutions are for this moment that we are in, where, by the way, there's more people that need medications for chronic disease, or if, for example, we're now in this new world where acute infectious diseases that we've never known about are popping up. And old ones that we thought were eradicated are now making a comeback. There's a lot of health crises out there. There's a lot of need. And what we've seen time and again is that the retail experience is just not meeting that need sufficiently. I think mail order is misunderstood, in part because a lot of docs, I'll say this for myself throughout training, we didn't know how to get our patients easily on mail order. It wasn't easy. It wasn't easy to do through the electronic medical record or hard paperwork, faxes. Just don't have time for that. And so now as the mail order experience has become easier simply to onboard a patient onto, I do think we're going to have a different type of tenor and conversation around how mail order actually helps with clinical outcomes, one. But then two, to your point on same-day delivery, it's a better experience, if you ask me. A patient that's sick with COVID or flu or an upper respiratory infection or sinus infection that needs an antiviral or an antibiotic, I'd rather that patient stay at home, continue to rest, not venture out into a busy retail environment, potentially expose others. And oh, by the way, they're going to get their medication in places like New York City within just a matter of a few hours. Clinically, that's fantastic. That's early treatment. And also it allows them to stay comfortable and rest at home, not expose other people. It's a win-win, and it's way better than going into a retail environment, if you ask me.
And these patients do have access to consultation via the internet?
So if somebody does have a question, let's say they are on a series of medications or chronic medications and they start an antibiotic, and they want to triple check if it's safe, or if they have a question on allergies, or if they have GI upset after they start an antibiotic, or a chronic medication, common things being common. We can answer that. We have a team of clinical pharmacists that are available around the clock, 24/7, whose specific purpose, Jeff, is to say, okay, this patient has a question, be it on a side effect or a drug-drug interaction, or maybe it's on, is there a cheaper medication for me? It's because the current one's too expensive. We don't just have an email submission form or an endless, we're going to put you on hold and have you listen to music for 30 minutes. No, it's very different for us. In under 5 minutes, you're going to speak to a clinical pharmacist, and they will triage to the extent that their license allows and is appropriate, your questions. And in many cases, these are these sort of level 1 clinical questions that either get answered or they're air traffic control. They can then direct or escalate and say, you know what, you need to speak to your provider. That's serious, or maybe you need to call 911. So there's that touch point, Jeff, that has not existed in the outpatient world that I think pharmacists are well capable of filling, which is to say, me as a provider doesn't know what happens to my patient often. When I send a script to their pharmacy, they're sort of on their own. And what we're saying here is that's not appropriate, that's not sufficient to encourage adherence and to, frankly, really optimize safe prescribing of medication. You need to support patients and provide them an outlet, and that's exactly what we're doing.
Let me shift gears and ask you about your recent agreement with Eli Lilly to handle fulfillment for some of their medications, diabetes, migraine, GLP-1s. What services are involved in that deal, and do you expect direct-to-consumer from the pharmaceutical manufacturer to the consumer to become more common?
Your last question first, perhaps. I think it's fascinating what Eli Lilly is doing, and if it means lower cost for patients at better care, then I'm all for it. But I think that remains to be seen. We certainly believe that Eli Lilly's intent is really focused on clinical outcomes. So we've seen some of their marketing materials, during the Super Bowl this year, focusing very directly and I think poignantly on safe prescribing of these weight loss medications. I mean, I think they were pretty direct, and I applaud them for that. They picked us for a reason. And I say this to you as a clinician. I really do believe Amazon Pharmacy very directly is the most clinically centric pharmacy in the country. That is what we're building. We're not building another pharmacy. We are building the most clinically forward pharmacy in the country. Because we know mail order works to improve outcomes. We have a team of clinical pharmacists available around the clock for questions. And that's exactly what Eli Lilly saw when they decided who are their partners going to be for distribution of these medications. They chose us for a reason. And that reason is they know that we can help drive better clinical outcomes because of our capabilities. So I do think that if you somebody that's going directly to Lilly Direct for, say, their weight loss medication or migraine medication, and then having it fulfilled by us, we're not just doing industry-leading fulfillment direct to doorstep. We do that better than what is expected in the mail order environment for pharmacy. Usually it's 5 to 10 days. We're in many cases just a matter of hours, but across the country, it's less than 2 days in every zip code. In some places, it's just a matter of hours. That's not industry standard, number one. Number two, what we've seen from our clinical customer support is that a lot of people that are starting these medications, these weight loss medications, they have questions. They have many questions, and they're actually doing outreach. They're calling into our pharmacy. They're seeking help. So they're actually leveraging everything we just talked about. It's one of the most cited reasons for inbound calls to our clinical pharmacy support line is people that have questions for these new start medications, in some cases through Lilly Direct. And so we're really seeing play out exactly some of the rationale for why we exist in the first place. We're hyper fast to the door, all the things Amazon does well, but we have excellence in clinical support. And somebody who's using Lilly Direct to see that very vividly.
You mentioned building out your clinical capabilities. How is Amazon Pharmacy trying to leverage its relationship with One Medical?
Well, I think One Medical is obviously within the home of Amazon Health, and we're delighted to be able to with such I think a very unique national primary care organization that's trying to do something different when it comes to enhancing patient engagement in the primary care experience. Listen, Jeff, there's so many primary care organizations that exist across the country, not enough to meet the need, But when you think about it, often there's some recent statistics saying that 40% of young adults who actually have access to primary care, to their employee benefits or what have you, don't leverage it because it's not an engaging experience. Needless to say, there's people who are underinsured or have no insurance for which access is a fundamental problem. But we also have a parallel problem that I'd argue is similar in magnitude, if not greater, where people have access, they're just not engaging with their healthcare. And so that's where I think One Medical is really onto something different. Those that take advantage, that are members of the service, if you're a Prime member, you can get access to this service at a very low cost, at $6.99 a month. It really gives you access to what I think is an elevated primary care experience where people want to engage with the experience. We have data that we're tracking internally, but the engagement rates for meaningful clinical interactions is something that we just don't see in the industry. When you think about benchmarks, people want to engage. They are delighted to come in, get their cancer screenings, make sure they get their cholesterol checkup that's indicated for them. Stuff that just, frankly, is, again, not happening at scale. And what do we have? We have a bunch of preventable severe illness that we have to deal with in the hospital, in the ICU in my case. So we think One Medical is an excellent clinical pairing for us. When it comes to strategic partnerships, if somebody is a One Medical member and wants mail order, they can set their preference to get their meds delivered through Amazon Pharmacy in their app. There's a One Medical app that's very easy to navigate. So there's some ways I think that are very natural where we're trying to say, well, if you're a One Medical member and you want a different type of pharmacy experience because you clearly want a different type of primary care experience, we're here for you and we can turn on that experience. But of course, they have options.
Then earlier you said the pharmacy system as it's currently constituted is not working well. And I think you'd agree by extension the whole healthcare system has some issues that need to be addressed. How have Amazon customers responded to your offerings both in pharmacy and healthcare more broadly?
We're emerging as a stakeholder, as a meaningful stakeholder in American healthcare. I think no one would say that. Everybody internally would tell you that we're just at the very beginning of our journey. And yet it's a very optimistic journey. If you look at just the growth of Amazon Pharmacy, we've had triple-digit growth just over the last 12 months. Our CEO references that growth during this earnings reports, and he's done so in the last several. So there's a lot of optimism here that what we're building when it comes to Amazon Pharmacy coupled with One Medical where appropriate makes sense. And we're seeing that in terms of tangible growth metrics. And speaking for pharmacy, there is a recognition when I talk to my health system colleagues. I was in the ICU earlier this week and talking about Amazon Pharmacy with a colleague that is curious. And the reaction to what we're building is, oh, that makes sense. Not that we're trying to force something. It's, oh, the world needs that. That makes sense. I wish I knew about it. And so really, I think the one headwind we're facing is meaningful awareness of our services. When people become aware of what we're building and how we're building it, they get really, really intrigued and they want to onboard their patients. It's really that simple. But I think we're trying to focus on, okay, how do we make the provider life even easier? How do we surface our information within their workflow so we can create any additional friction, but we just streamline as much as we can? So that, I think, is our big near-term headwind. How do we build meaningful awareness that we're doing just something fundamentally different that, again, is not just yet another thing in healthcare, yet another point solution, but it's something that can actually meaningfully improve clinical outcomes?
How is Amazon trying to get that message across to your colleagues in the physician community?
It's the hard work of trying to unlearn behavior. And I say this as somebody that's guilty of it myself, which is you don't think about prescribing into pharmacies and changing the pharmacy on file, whether you're a patient or whether you're a provider, Jeff, unless you absolutely have to. It is one of the most habituated parts of the healthcare experience. We know what pharmacy we're used to going and picking up our medications at. 90% of meds are picked up physically at the retail counter. People spend, we have internal data suggesting, survey data that characterized how much people spend waiting in the pharmacy line every year. On average is 13 hours. then we have normed ourselves to a suboptimal, mediocre experience. And that is an input into the often cited phrase that American healthcare is broken. We always hear that. Everybody says that. Everybody is one of the few things I think all Americans can agree upon. What's one of the inputs there? It's that the pharmacy experience is pretty terrible. It's a mediocre experience. And no doubt there's a correlation between how people feel about their pharmacy experience historically and why everybody says American healthcare is broken, to your point. And so if we're drawing a direct line between that sentiment and those two sentiments, that's where I think we have a lot of room for improvement. If we can fundamentally address one of the major inputs into that just sort of miserable feeling that people get when they think about having to navigate the healthcare system, if we can make pharmacy easier, again, 10% of meds are filled through mail order. I think historically, because providers don't know how to get their patients on mail order, it takes too long, we're solving for those problems. Our motivations are not just to get prescriptions sent to our into our organization. It's far more than that. It's really rooted in our belief that we can drive better clinical outcomes in a world where 50% of Americans have medication non-adherence. And oh, by the way, you asked about partnerships with One Medical. Our clinical pharmacists launched on their own accord an interesting service that's really focused on de-prescribing medications where appropriate for seniors that are higher risk. So, for a pharmacy to say, we'd rather you be on less medications if you don't need to be on excess medications, I think that really signals where our intent is. Better value care, delivered through just a world-class mail order experience, but also with clinical excellence that might actually minimize the number of medications somebody might be on. So I think really strongly that shows our intent here, which is better care.
Final question for you, and this overlaps a little bit with what you've already been discussing. Amazon's known for beginning with the customer and working backwards. Are there emerging issues that pharmacy patients have that you're identifying now?
What we've realized, and I think what our stakeholders out there in traditional healthcare have told us, is there's a lot of preventable illness that doesn't get diagnosed early enough and results in delayed treatment, and then ultimately results in somebody ending up in the hospital with a stroke or an MI. And so what I think we have understood and are trying to develop solutions for is, how do we get people to engage in their healthcare journey as early as possible? And then from a pharmacy standpoint, if they were to have a problem because they've identified something through their family history, or maybe they have stage 1 hypertension that they didn't know about because they're asymptomatic, how do we get them on therapy as quickly as possible? Or if they need a preventive screening, pivot them to primary care. They have an option at One Medical, of course. But how do we identify disease as early as possible in its tracks? That, to me, is the big gap in healthcare that we hear time and again. Early disease detection, then coupled with a world-class, highly engaging patient experience for triage, ultimately the treatment. Whether you're talking about acute illness or whether you're talking about chronic disease, that's the challenge. How do we keep people away from the four walls of an actual hospital system? We're going to have to do that more and more, because by 2030, we're going to have a lot more need in terms of an aging society, far less in relative terms healthcare workers to really meet that need. So we have to leverage these technological solutions in a way that allows for early disease detection. And I'm heartened to see there's diagnostics on the horizon that are just much more again, that focus on engagement that people might be willing to interact with to see if they have high blood pressure or maybe high blood sugars or high cholesterol. Easier way to diagnose colon cancer through a blood test, as an example. We're really entering a different transformative era of patient-empowered care because we have better diagnostics to give them a sense of what's happening. But then, oh, by the way, pairing that with what we're building at Amazon, which I really do believe, again, is industry-leading from an engagement standpoint on primary care and pharmacy.
It'll be exciting to watch as Amazon takes on those challenges. Ben, I appreciate you taking the time to update us, and we'll talk to you soon.
Well, Jeff, thanks as always.